Okay, so this is a deep-chested beach spay, and they're going to do several things to try and make life easier, which we'll see as we progress through the surgery. So, incision's just behind the umbilicus, so as close to the ovaries as we can get, because obviously, as we know, the deep-chested are difficult to exteriorise the ovaries. I tend to nibble out the fat. Reason being is when we apply the clamp later, the fat can bulge up, and when we do the ovarian clamp, it can get caught in it. So I prefer to actually nibble out the fat above the linear elbow. She hasn't got much fat, surprisingly, and we can tell the linear elbow with this one because it's got an indentation here. It's very easy to miss the linear elbow when you're going in by a few millimetres, so even with lots of experience. So we're going to tent up nice and high and do reverse blade with the handle parallel to the body. So just pick up in the middle, grab it to the side, try and make sure we've got it central, and then we'll do our stab incision and up. Ideally first you want to check your stab incision's gone through, so go like that, and it looks like we've gone through fine. Sometimes you'll go down just a slight to the side and you'll see peritoneum and muscle when you're off it, so you need to nibble into the peritoneum to get back on the right track. Extension, I usually keep it simple. Tend to just lift up and just use my scissors to follow down the linear elbow. Some people put forceps in like this to hold and then cut down. There's a few people who use a reverse blade with forceps, but initially I'd say just start with scissors. The hole needs to be big enough so we can get our finger in and hook the uterus and pull it up. So I'll have a go at that. Seems to be big enough. And these fatty dogs, the uterus can be quite difficult to find sometimes, because it can sort of feel like intestine. Now you see that's the uterus, because we've got a bifurcation here. Ideally when you're feeling, you want to be going down the body wall, touch the vertebra and start rolling back, trying to hook the uterus. It usually runs sort of parallel to the vertebra deep down. When they're older it can vary, it can sort of be a bit more raised. So per normal we can't get the ovary out, so we have to use one or two methods. One method is to pinch down to get it, or the other method is pull on the skin and roll over to try and get it. So we'll try the skin on first. So put a little bit of tension on, but hardly anything. Pushing down on the skin and then just rolling over to get that. Just trying to show you once more. So got the uterus there, hooking on the skin here, pushing down, rolling over and grabbing the vertebra, grabbing the ovary, sorry. So now we've got the ovary, we can break suspensory. Never try and break suspensory unless you've got hold of the ovary, because it'll damage somewhere else. Now breakage suspensories is very important to do it correctly. Try and avoid this twanging. What you want to do is have hold of your ovary like this, keep the tension on, hook your finger on top of the ligament and slide all the way down, right down, as far as you can go, so it inserts to the rib. Just pressed it and it's gone. So if you use that method, you can mainly break suspensories, as you can see that in 1 second. So try and use that method, go all the way down and tweak it at the insertion. Okay, so now we've broken the suspensory, we've got a bit more exposure on the ovary. So we're going to make our window. Window needs to go somewhere safe, not near the vessels. So we're looking down here, deep down, because this is where we want our millers to go nice and low. We can see a nice area there that's clear. So we'll extend that up. And now we place the car mark clamps. Just thought I had ready. There we go. Okay, we use the car mark clamps because they are atraumatic, very smooth, so we can place them and move them again if we need to without worrying about any damage. So, window's there. I'll place them through and I'll just hold. And then I'll hold the ovary and push it down a bit and hold it again. Check nothing's in it. And then push it down again. Nothing in it. That's probably enough now because we're about well past an inch, nearly 2 inches past the ovary. The ovary's here. So for a broad and deep chested dog, that's pretty good. So, okay, next thing we're going to find weird, we separate the uterus. So we place one clamp behind the ovary, it's here, and the other clamp alongside there, fully ratchet it, and then cut between. So that means now we've got better visibility on the ovarian pedicle here, and there's an additional advantage which I can show you later as well. So now let's get our millers on. We're going to put one millers on, raise the clamp, and then do second millers. So refer to the videos about how to do the millers. So you just wrap it round underneath the clamp, finger there, it's your start position, make the cross, around again, make the second cross, and then with your forceps go through, grab the tail, pull the tail back, and then just shuffle it down a bit but don't tighten it. So what we're going to do now is we're going to just get this millers a bit lower. We don't want it forming near the clamp because it won't bite into the tissue and give us a nice tight knot. So you see there, I'm just dragging it down, pushing it nice and low. And you can see on this side, again it's nice and low. Okay, so when we come to tie it, you're best keeping a rotation on the car mark clamps like this. Put that clamp there, and then when I tighten, it's going to make sure it's not going to be tightening next to that clamp. So now just take the time. We always go 100% strength. If it cuts through fat, it doesn't stop us, we still go 100% strength. Just take your time, won't go any tighter then, and again then I can't go any tighter. So now I'll do my 6 ones. First few ones need to be, again, nice and tight. I always lose count and with ones I've done. One ruffle up, So what we're going to be doing now is just cut the tails on this one, and then we're going to test it. This is the other advantage of separation of the uterus. We'll get some blood coming out of this initially because it's been trapped. Put that up, and then we'll release this clamp, and we can see already that that's good enough almost on its own. So now place the clamp higher, again still below the ovary. So we're clearing the ovary. It's always putting that back on so you don't get it trapped. And then save that for the uterus problem. I'll do it now. So we're just going to do another Miller's. I'll have to get another strand, I don't think it's long enough. Okay, so and again, second cross. Okay, with this one, as long as it doesn't form alongside the clamp, it doesn't matter, so just drop it a bit. So just drop it a bit. Like that. Just like that. And again, we can rotate the clamp to ensure that it's not getting tied too close to the clamp, the car mount clamp. So you can see there it cuts through the fat. Always use a push-pull. And if you can, get in the habit is place it, release it, tighten it. Place it, release it, tighten it. Always using the push-pull, so using your shoulders. Place it, tighten it. Place it, tighten it. Place it, tighten it. Okay, so we know the first one on its own is okay. Right, never start pushing around here to check your ligatures. I'm going to check them. Oops. Always check them on this side here. And you see that nice pinched in there. So the only time I tend to cut with a blade is now. Let's take the area off so I can go flush to the clamp. And then I've checked it, so I know it's not going to bleed, but if you want to check it again, the important thing is never hold your ligatures, never hold below your ligatures. The only area you can hold is above your last ligature here. And sometimes you won't have enough tissue to hold it. In this case we can, so we can just hold on to it like that. There she goes. Right, so quite often I do the broad ligaments at this stage. Broad ligaments can have two reasons for doing it. One is to have no bleeding, because tearing could result in some bleeding, and the other is to remove the fat where we're going to put the ligations on the body of the uterus. So let's go deep as we can. See the uterine vessel there stays with the uterus. So make our window somewhere over here, and then want to extend the window up so this isn't under tension when we tighten it off. So 1 clamp, 2 clamps. Because we've done 2 clamps, we can now cut between and just have nice exposure on this that we're going to tie off. Surgeons are usually sufficient. Just wrap it round, rotate the clamp, because again we don't want it forming near the clamp. Okay, so that's the broadie done. And then onto the other side of the uterus. Okay, so like before, we can't get to it. Usually this is more accessible, so we're just going to push down. You just push down to get it. So you can't pull it out, you push down to get it. And again, the most important thing, we have to have hold of the ovary to break the suspensory. So keep hold of that ovary there. And then just run all the way down. From the end of the table, down the suspensory. Now there's kidney ligaments, suspensory ligaments. They both are actually suspensory, but refer to them differently. Don't break the kidney one. Quite often the kidney one isn't palpable. But the ligament, the suspensory one, as you go down, you want the comfort going past the kidney, so you know you've got the correct one. Keep the tension on, and then just press it at the base. And there you go. Took again 1 second to break it. It's like pulling up a weed. If you're close to the root, it's a lot easier to pull it up. So I'll put our swab here. You see ovaries up here, it's got massive exposure we've got because we've done the suspensory well. And then we'll place our carnal clamps. Make our window. So nice and safe and deep down. There, take it up. Carnal clamp. Just there, fine, that's about 2 or 3 inches away. Okay, and then we do the separation of the uterus. So you clamp just behind the ovary, just alongside. Put between. I've got our pedicle here. I'm ready to tie off. Got a bit of swab in there just to keep the dobbins out of the way. So, new one thing. So again, wrap it round. That's our start position. There. Let it cross, go around again. Second cross. Goes through, 2 strands, 2 strands. Grab the tail. Tail like what it was, and then just shuffle it down a bit. And then we want to drop it like we did last time. So we rotate the clamp this way. Because it's loose, we can just grab it and push it down. And then on this side again, we can push it down a little bit more. There. So to tie it off, we keep rotation on the clamp like that. The clamp's rotated that way, which again makes sure it bites lower down, not up against the clamp. Again, take your time. Always work close in because you get it a lot tighter. Have better control. I can't get any tighter, so do the 6 ones. So place, release, tighten. Place, release, tighten. More for luck. Okay. So we'll trim the tail short because you don't want to get in the way of the other one. We can do our test again. So we'll release that, knock up any blood, and then we'll release the Carmine clamp now. You can see there's no bleeding. So there's no bleeding now, we'll release that Carmine clamp. So I'll reposition it again so it's below the ovary. Now I've got loads of room. And then we'll place our second milli. Leave that on so it doesn't fall off. Like I say, just shuffle this down a bit. Oh. Always make sure we've got nothing caught in it. Let's have the clamp there. I'll just use. Sometimes when it's a short piece, I tend to put the clamp on as a backstop. Take your time, keep checking it's the tightest it can be. Put lots of suture in your knee holders, it's less likely to break. That's it. Tails, get this swell out now. Put the ovary off, fish with the clamp. And then you can. Again, we're going to hold it, it's atraumatics, make sure we've got lots of space. We tend to always get a bulge, so a bit of blood comes out from the bulge. We've already checked the first one, so we shouldn't be expecting issues. And see how it doesn't fire in because we broke the suspensory, so I'll nudge that in. Now we've just got to do the other part of the broad ligament. So uterine vastas of the uterus, so we can make our window down here. Extend it upwards. And do a clamp. between. And just tie off the broad. Fine. There she goes. So now we're just going to tie off the uterus. That's how it should sit, I think. So we're just going to go with the surgeons and millers and a transfixer. Sometimes what it's worth doing is test the uterus, see how fragile it is, put a full clamp on. Yeah, it's okay. Uterus is kind of cheese wire, that's why I tested it. And that's the reason why we put the surgeons on first. It's less like it's cheese wire than the millers. When you tighten your surgeons, the first couple of ones are the most important because they'll tighten the surgeons not the most. As you place the surgeons, it always bounce back a bit, so the first two ones are very important. Okay, so that's our surgeons. Now we're going for the millers. Second cross, through, grab it, tighten. Always try and keep the strands close together. So I've tightened it, but I've held back just that bit. I think because of the cheese wire one I had yesterday, no, Saturday. Okay. But you can sort of have a look and see it's got blanchness. Okay, now the transfix is just focused solely on the uterine vessels. We use a straight needle because we can predict where it's coming out. Because we're going to take it through the uterus. Two strands, so just behind where the millers is, we'll just go through, and then if you look at the other side, so it comes out in the middle. Once we've pulled it through, we want to make sure both strands are about equal length, like that. And then we cut out the needle. Now just check which side goes with which. So as we pull this one moves. So it's going to be on that side. And this is going to be on the other side. So basically we're trying to fix in both sides equally. Yeah, that moves going to do that. So we can go full strength on these, because if it does cheese out of your uterus, it doesn't matter because we did it on the uterine vessels. Exactly the same on the other side. So always give yourself quite a bit of space after the transfixes. So put something like that. And then we're just gonna check. No bleeding. It's okay. So let's do the closure now. So if your needle holder's ready, and then use both forceps to get your muscle. You always want to know where your needle tip is, so at all times. You always want them snug, so it's not tight or too loose, just snug. And it's good practice to do one at the bottom and do one at the top. So they're the hard areas to access. So again, needle holders loaded up, 2 pairs of forceps. Also where you want it. This umbilical fat, if you go through it, don't worry about it. Just ignore it basically. Thoughts of picking up the peritoneum seem to vary several years to several years. Whether you should or not do it. do a cruciate here. Deep superficial through the fat. Do that, stop myself pulling it through. So, mirror image, so we're going to go superficial deep. And the very important first pass is deep superficial to keep that knot under. And then you can actually just go back on yourself. The closure. Just to show you another thing as well, you can do a muscle tack. So it goes through a little bit of the muscle. So it then tacks it all down, reduces the dead space. Make sure that gets covered. There we go. Do one more tack through the fat, tap the muscle, and through the fat on the other side. A few more passes. It's tough for the surgeons. Cut the long piece off. Sorry, cut the tail off, keep the long piece, because we're just going to go straight into intradermals. taking it 2 steps forward, 1 step back. And through, and then we go back a little bit. Keep checking we're not coming through that skin. Just okay. Take one more pass and then form the knot. This one I'm going to finish with the surgeons. You can, by tightening this, you can control the tension of the wound. Cut off the loop completely. There's no tail at all. And then secret of burial is it's got to glide through for not to follow. So just find the area where it just sort of glides through. Go with that. And the other important thing is to actually pull on the skin, don't just pull on the suture. So just help pull on that skin and it's buried the knot perfectly. There we go.